So we just keep doing what we do best, and that's help people.
Think about helping the people and the citizens of PG County.
Come on, check it.
Basically taking care of home with your family there and then taking care of home here with your family in the department.
We take the precautions that are set in place, come to work every day, and just do what we're supposed to do.
Cleaning and disinfecting the entire station, all the apparatus that we ride on.
That's the job that we signed up to do, so we're just here to do it.
And they've been stepping up, and we appreciate our community stepping up for them.
So very early on in January, we started to hear the accounts from other countries of just things that were going on as it related to COVID-19. So as an agency, we leaned forward, started to look at our policies and procedures in infectious control, how we deliver those services, in addition to our PPE, the equipment that we had. Gratefully, we had a cache of N95s, gloves, and gowns that we had from another experience, and we saved those things. And so we were able to do an inventory and quickly see that we were able to deliver the services.
We stood forward very early and started a procurement process to get as many masks and gowns and gloves and clean equipment, sprays, paper towels, things that you would never even think that you needed. We started really early, pulled a team together. We had to make sure that we, back at logistics here, acquired all of that inventory from the station. So we all know firefighters have a lot of things and they like to kind of hoard the equipment that's special to them. We had to step up and go into those fire stations, and in Prince George's County we've got 45 fire EMS stations and we occupy 53 facilities. So we had to go into all of those stock rooms and recover all of that PPE, which was all purchased with county funds, brought it back into logistics, and now we controlled the movement of that PPE out of logistics.
In regards to our policies and procedures, we were already operating under infectious control policies and procedures that were implemented years before. We updated those policies and procedures and made sure that they were applicable to COVID-19 as it relates to us delivering the service and us protecting ourselves.
We started educating our providers. We started looking at disinfection and sustainment capabilities for our units and our personnel. As an agency, we biosurveil our CAD system, our 911 computer-aided dispatch system. We surveil our EPCRs, our electronic patient care reports. We surveil those systems, and they're looking for keywords. And when those keywords start to hit, we get text message alerts, we get emails. As a result of that, of those notifications, we started to see this early.
We communicated with the volunteer departments every step of the way. Every time the department was making a decision on how we were going to operate, what supplies we needed, we coordinated all of that every day with the volunteer leadership. And there was a lot of cross-communication back and forth. So communicating happened very well between the entities.
We had, swearing in on the 4th. It was a great day. 13th fire chief, first female fire chief. That was an overwhelming day, and we enjoyed all the festivities that come with that. And you think that there's going to be a little bit of time to slow down, and literally within weeks, we are right into the middle of the biggest pandemic we've ever seen. Zoom calls, press conferences, a lot is going on, a lot of policies and procedures that we have to implement, and most of them our first time doing that. So as a new fire chief, it was overwhelming, but a lot of the feeling was just managing the everyday aspects of not only being the fire chief, but also making sure that they're safe. I am, but I really appreciate what you guys are doing. So let's keep doing a good job.
Thank you, Chief. Thank you, Chief. Thank you.
I would say huddle up, but we can't. Every day things were changing. And as we went into a state of emergency, we were literally getting information by the hour of policies and procedures that we needed to change, how we do business, what we wear, is it N95s, is it surgical masks. And the one thing that we remained was flexible. And we just really wanted to make sure that we got that information out to the providers. We're getting the information from the county exec's office and from MIMS and from our state partners, but they're getting the information from us. And so we had to deliver that real time. And so that went from memos to just using our signage boards and our stations and just using our social media platform to make sure that providers, the frontline employees that are doing the job every day, had the information as quick as we could get it to them. Hello. As you are aware, we're in the middle of an ongoing national response to a pandemic, and you are on the front line. We are one county, one department, with one mission, and that mission is service to our community. This is who we are and why we are here. I know you are stepping up while worrying about your own families and loved ones and making sure you are taking care of everything you can at home. I want you to know that I am proud of you, I support you, and I thank you for your service. Here's the deal, and I'm going to put this as plainly as I can. I need you to be safe. I need you to work smart. We establish safety protocols for your own safety. However, the safety protocols don't work if you don't follow them. These protocols are not only for your safety, but the safety of the citizens we serve, your fellow coworkers, and your family at home. Please review the protocols and then drill again. Don't cut corners with the ongoing safety help stand down. Disinfect high-touch areas, clean your stations, make this a part of your daily routine. Protect one another. Adhere to the PPE guidelines. Adhere to the response guidelines. For example, everyone needs to wear a surgical mask when within 6 feet of a patient. Not everyone needs to go treat that patient. The unit officer should limit exposure by sending 2 providers to evaluate the patient and only utilize additional help if the situation demands it. All other personnel should stand by until requested. And only those providers who are within 3 feet shall don the gowns, goggles, masks, and gloves. If you are one of them, I implore you, wear your protective gear. These are just part of the protocols you have been asked to follow. Keep in mind, these are constantly being updated, and we learn more about COVID-19 every day, so stay up to date. Folks, every single fire and EMS department across our nation is monitoring their supplies hour by hour. This event will not be over in a matter of weeks. It's going to be several months. We are prepared. Our Logistics and Facilities Office has placed orders for more supplies. They are working around the clock to try to ensure that there are no breaks in our supply chain. But there are going to be challenges. It is imperative that we work smart. This is what we do. We know our infectious disease control protocols. Yes, in some ways, COVID-19 has caused us to adapt, to change how we work, but it will never change why we work. It will not stop us from stepping up and answering our call to serve. Be safe, be smart, look out for one another, and let's continue to do what we do. We stood up our Department Operations Center as soon as we went into a state of emergency, and that was very important because that gave us a focal point where all of our information was flowing. We had assistant chiefs and battalion chiefs staffing this Department Operations Center, and it's important for the department to be able to see that in place, to be able to have a 24-hour number that they can call when there's questions, they don't know what to do. The other thing we did, we upstaffed our units. We immediately changed our operational perspective to make sure that we had the resources in the county to be able to deliver that information real time as well.
So we are a tiered response fire EMS system. We are ALS and BLS. So we send 2 transport units to most ALS calls, which in normal times allows us to evaluate patients and make sure that we are using our resources to the best of our ability as an agency. With this response, as we start to see the severity of the illness associated with the virus, we realize that we need to conserve these resources. So instead of sending 2 of these to every single ALS call, we send 1. And we are still in that modification response today. As a result, we've been able to make sure that we've had resources available throughout the entire pandemic. Now, just like in the rest of the country, we actually saw about a 30% drop in our call volume. We did see about a 25% increase in our cardiac arrests and our priority 4s, or our patients that we pronounced dead. We saw a dramatic increase in those, but we saw a reduction in overall call volume. Now, typically on an average day, we respond to 70% BLS calls, 30% ALS calls. During the pandemic, it was reversed. 70% ALS, 30% BLS. So it took more of these, it took more ALS units during the pandemic. So the fact that we changed our resource deployment early allowed us through the entire pandemic, it allowed us to make sure that we had resources available to respond to calls.
Those volunteers that worked in other jurisdictions, they had double exposure, both at work as a frontline employee as well as a volunteer within the county. So they were more at risk than some of the others. Some jurisdictions did not want their career personnel volunteering or having that secondary exposure, so they may have limited or restricted their members from participating. Most of the volunteer stations that did very well, the ones that could participate, stepped it up a little more to cover those gaps where members could ride. Folks were off of work or out of school, or colleges were closed down, so those folks came to the fire station to fill in because they had plenty of time to spare.
So our fire and EMS providers are used to dealing with dangerous situations. They signed up to do this job. They go into burning buildings every day. The anxiety came with bringing that home to their families. And I think that's what really hit home for me, was they weren't necessarily worried about themselves. They were worried about potentially taking this disease or this pandemic home to their loved ones, their elderly parents, their kids. And that caused pretty much the biggest amount of anxiety, not even just for them, but for me as well as their leader. So for me, it was important that we get them all the information that they needed to understand exactly how the disease could be transmitted, what we could do to protect ourselves, and it was also important that we provided them with the protection that they needed, the proper PPE. I mean, we spent hours making sure that they had, N95 masks and gloves and gowns and surgical masks, just everything they need to do their job safely so that they could protect themselves and their families.
So we had to go through and develop these trigger points built in, knowing that these stations, based upon previous call volume histories, we knew how many calls they were going to run, and our trends changed daily. But instead of just allowing stations to order what they thought they wanted, we allowed them to get the equipment that they actually needed, and we made sure no one ever ran short. We kept a stockpile, but that was the secret to our success, was the fact that we managed the inventory with trigger points for every single station and unit in the county. A tremendous amount of work, a huge undertaking by multiple offices. I mean, that was a combination of Emergency Services Command, Support Services Command, which is under my authority, Administrative Services had to do all of the purchasing, Volunteer Services Command of getting the information out and that distribution out to the volunteer stations. Then, of course, support of Fire Chief of being that person that would stand up and say, my agency needs it and we need it now, and we were able to get what we needed when we needed it.
It's important for me to make sure I did everything I could, and even every day, at the end of our Zoom calls and conference calls and text messages, the constant message to the deputies is, have we done enough? Have we done everything possible? Have we looked outside the box? Are we reaching out to the other regions to see what are they doing? Can we do that? And exhausting every means necessary to protect our providers.
We were looking at CDC guidance. We were getting guidance from the National Capital Region. So all of these, whether it was the federal government, the state government, or local government, we are members with several, the International Association of Fire Chiefs, the International Association of EMS Chiefs. All of those organizations were feeding us really, really good information. And we were looking at that information and trying to stay ahead of or look at the opportunities to make sure that we were instituting those policies and procedures. As a result, the recommendations were made to the chief to do health assessments, walking into the station, working with logistics to get thermometers, and making sure that we documented that information. And as an agency, we had to make a decision to stop all non-essential personnel from coming in the station. So minimizing our responders' contact with outside influences while they're at work as much as possible. Trying to lean forward to say what's the best thing we can do to protect our people is face coverings in the stations. So we had to teach them you can't have 12 ladies, men sitting at a table eating dinner together. You got to separate it. You got to do it in shifts. We looked at our sleeping facilities. Some of our stations are really, really tight. So those challenged us to make sure that we could social distance our personnel, but it was really a focus. And it's been a focus of our staff, and it continues to be a focus.
We hit critical shortage points several times through this. We knew where the equipment was available, but we had to use the authority of our agency director, our fire chief, to step up. And that's the one thing we're thankful for, is that our fire chief was our advocate. But in order to sell that, we also had to have real data, which is something that we had, our total call volume every day. We had call volumes per station. We had burn rates every day on the amount of PPE we were using, broken down to every single piece of PPE. For once we got donations, we'd have to validate those, make sure that they met the CDC standards, make sure they were in date, make sure it was something that we could use. We had to go through the health department for approval, but ultimately our community rallied, and they brought us so many things. I mean, our local vendors supplied us with hand sanitizer by the truckloads. Our local beer and liquor distributors stepped up and gave those critical items that we needed, because those were the N95 masks that we got so many early of were because of a donation. The hand sanitizer was completely unavailable when our local liquor and beer distributors stepped up and donated those to us. So we were very fortunate to have that community support.
Some of those communities, the businesses and stuff, or community organizations, provided meals to the volunteer firefighters. The volunteer companies also provided some of their own meals to keep people at the station. But it was a good all-around effort for the volunteers.
That it was overwhelming, the amount of community support. Our fire and EMS providers showed up for the community, and they in turn showered them with love. I mean, everything from food, letters, compression socks, we got it all. So we've gotten a lot of support from our community. I mean, not that we haven't had that before, but during this particular time when it's hard for firefighters to show up to work every day, knowing they're leaving their loved ones at home, to be able to show up to work and a local restaurant is stopping by to bring them lunch, or just stopping by to say hello and tell them that they appreciate what they're doing every day, it made a world of difference. So it was important to me as a fire chief to then showcase that community support.
So 1,500 for the police department and 1,500 for the fire department.
You start over there.
More than you thank us, actually, we wanted to appreciate you guys too, what you guys been doing, and that's all we really need. So.
We appreciate it. We appreciate them coming out and giving us supplies, especially this time.
We're here to serve the community, and for the community to be able to help us in return, it's a good feeling.
I live in the county. I also work for the county, so this I love.
This is awesome. It's awesome that they could come out and donate to us at this time of need.
The outpouring of support from our community is overwhelming.
It's really critical for the town of Bladensburg to support our firefighters, given they're on the front lines in the middle of a global pandemic, putting their lives on the line to protect the Bladensburg residents as well as others in nearby communities. So the least we could do as a town was gather food resources, shoes, any other resources we can get our hands on, just to let them know that we care and we're grateful for the sacrifices they're making on behalf of our community each and every day.
The company wanted to contribute.
I'm sure we'll go to use probably today.
Okay, 29 communications, you can hold us ready.
Hold ready.
You allowed me, a single parent, to surprise my daughter because she can't have her commencement at Towson University. This was better than I'm sure the commencement would have been.
I wish I could thank you guys 100 times over. I'm truly blessed, and I will remember this forever.
The firefighters made his day, and when he saw those red lights flashing, his face looked like somebody had given him $1 million. We were so excited. Thank you guys so much. You made this mother so happy.
As this became critical worldwide, vendors would now come to you and say, I want to sell you PPE, I have it. We took them on their word in several cases, and 6-8 weeks later, at some time at this point, we have vendors that still haven't fulfilled. And that's the one thing I want to pass on to everyone on the other end of the camera is, be very leery of who you order from. Even some of your larger vendors, they're in it for the sales. They want to make sure that they sell the PPE, but they don't necessarily have it on their shelves, and they have no control on when they're going to get it, especially when you hit a worldwide crisis like this.
I guess the biggest challenge related to the COVID-19 is the duration of it. It's been a long-running incident, none that we've ever experienced before to this magnitude. So it's been challenging, it's been life-altering. What helps is the resiliency of our personnel. We've also learned that we need to take care of one another, make sure that we're watching our fellow members that are standing next to us on an incident to see how well they're handling things, because it can wear on you.
The big thing is we'll get through this pandemic, but how will we, evolve mentally? How will our employees deal with that? So we wanted to put those resources in place ahead of time so that, the men and women of this department had people they could talk to. The big thing was the peer support, because they're talking to people who understand exactly what they're doing. They understand the anxieties, the fear that comes with, working in this type of environment and potentially taking that home. And the peer support team, they went around to all the stations, and they did the things that were necessary to give our employees those resources and our volunteers that, that resource as well.
The biggest lesson is you got to talk to your neighbors. You got to know what your neighbors are doing, and you have to be willing to share. Taking guidance and looking at the guides, and then looking at our department and the challenges within our own agency and how we were going to overcome those challenges. So consider everything, but make sure that your decisions are made locally.
Decon was a challenge. Of course, every vendor comes along and they want to sell you the latest and greatest decon machine. We didn't jump on that. We took the early approach of making sure our folks had the PPE needed, the spray cleaners, the paper towels, the things you need to clean, but we also purchased commercial paint sprayers, which worked out phenomenal. We followed the CDC guidelines, and we had a bleach and water mixture, and we were able to spray our units down in a matter of a couple of minutes. They would air dry within about 10 minutes, and our units were back in service. Did we learn anything from this? Yes. Currently, Prince George's County has 20 new ambulances on order. As part of that, we built in this piping system similar to sprinkler system that will be able to hook up a bleach sprayer that atomizes the bleach and water mixture, and will actually pump that through these heads inside of our ambulances, front compartment and rear compartment, to be able to sanitize those units on every single incident.
The one other thing that really came out of this entire thing is communication, right? So communication challenges every agency every single day, right? So finding ways of tapping into our people and getting feedback and giving them the information they need down to the lowest level.
We realized early on that we needed to have a platform for communication that goes beyond email, social media, Twitter, all those things. And we really had to rely on that and be flexible in regards to how we got the message out to our troops.
EMS went to daily calls with their EMS supervisors. I went to daily calls with our battalion chiefs. We reached out to our staff at the station level. We did conference calls with them. The medical director did conference calls with them. They gave them an opportunity to ask questions, get feedback, address their concerns. They were concerned.
Prince George's County is very unique. We're a large metropolitan fire department running somewhere around 300,000 unit responses, 152,000 calls a year. So yes, we're busy. Some of our smaller agencies across the state will have a completely different concerns. They may not have the funding that we have. They may not have the resources of a true logistics and supply. They may not have the large buying power that we have as county government. And that's something that you need to start talking about with your executive leaderships, with your council members, with your mayors, with whoever the leaders in your community are, and within your own public safety entity itself, and make sure that you have the funding, because we weren't expected for this. Were we prepared? Not completely, but we recovered, and we've been sustainable through all of this, and we're proud of that. But it took a tremendous amount of effort for a lot of personnel involved. If I can pass anything on, please check your logistics inventory. Make sure you have everything that you need for the biggest emergency. And if you don't have it, start having those conversations now on where that funding is going to come from very quickly to make sure that you can keep up. Because we can't stop serving. If it happens tonight, overnight and you're not prepared for it, what's going to be your next step? Yeah, have those conversations, those political conversations now about where is that funding going to come from.
We are looking forward to what the next wave, if there's another wave, what that looks like. From a planning perspective, I need to factor that in. So I think it's important as a supervisor to put my foot on the brake, take a look at the agency, see where we are so that we can get back on the gas pedal and move forward as an agency.
I did station visits and just spent a little bit of time talking to them, making sure they understood I knew exactly where they were and the feelings that they had, the anxiety and the fear. And I wanted them to know that they had my support and that I was proud of them. They showed up every single day.